Hey everyone, it's Dr. Carl Baird at Evolve Performance Healthcare. Today we're going to discuss reasons why you might be getting knee pain on your run. So again, these are the three most common things we see in the clinic, and it doesn't matter the condition. It usually goes back to one of these three things. It could be your meniscus, it could be your IT band, it could just be patellofemoral pain. They can all be traced to one of these three things, and if we figure out which one it is and get on a plan to correct it, you can overcome knee pain and get back to your running routine. So the first one that we're going to talk about is right here at the top. So again, easy enough. Your body's not strong enough to support your run. So running does take a good amount of strength. Our muscles are meant to be our dynamic stabilizers. And when our muscles aren't strong enough to support that activity, well, we start to rely a little bit more on our passive stabilizers, which are our joints and our ligaments. So if we're not strong enough, we're going to rely on those passive stabilizers. You're going to get more impact at the knee. More impact at the knee, eventually, the more miles you put on it is going to lead to knee pain. So to correct that, you may need to get on a strength program. Number two, your body is too stiff. So this is kind of the other side of the spectrum, but you see it a lot. If your body is too stiff, it's not going to be able to absorb the ground forces of running. So instead of smoothly being able to absorb the ground with each step, you're kind of hammering it home. And that just, again, sends more force up the knee, more impact at the knee, more impact at the knee. Eventually, you're going to experience knee pain. So it's important that, again, we make sure that we are mobile enough. And the third is, again, imbalances. So these imbalances can occur, first we'll talk about side to side, so kind of leg to leg. The truth is, if you've ever had surgery on one leg, if you've ever even just kind of sprained your ankle, the number one predictor of a future injury is a previous injury, because what it does is it changes the way you move, and you start to favor one side. And again, especially with running, where there's just a lot of repetitive motion, a lot of miles put in there, those imbalances can grow. And so to correct it, you got to correct the imbalance. The other one is, again, front to back. So especially in recreational runners, you see this where, again, most of us have jobs where we sit on our butts for 8 hours a day and then we go for a run. Well, what happens is our hamstrings and our glutes didn't work or weren't needing to work for 8 hours of the day, and then we try to get them to go for a run and they're either not engaged or, again, they're too weak. We become more quad dominant. That's more force through the front of the knee, very common in people that, they have the pain along the front, usually front inside is very common there. So those are three things that, again, can work: IT band, meniscus, patellofemoral pain. You fall into one of these three things. So if you are experiencing knee pain on your running, it is important that you figure out which one of this it is. So again, not everybody has all of this. Everybody is a little bit different. So again, if you start a strength program, but you have a mobility issue, you might not get the results you want. So again, if you do have knee pain, want to get it checked out and then a plan to fix it, that's what we do here. We've been working with runners for over 10 years now, get back to their running routines, even when nothing has worked. So we've worked with people who've had knee pain for 15 years, whose doctors have told them, you got arthritis, you're bone on bone, you should just give up running and exercising completely. Usually that's not the case. It always goes back to one of these three things. And again, most traditional medical clinics don't take the time and energy and effort that's needed to figure out what it is and then put the plan together to fix it. So if you do have questions, go ahead and click the link below. We'd be happy to answer them for you. Thanks again for watching.